know that as viruses evolve, they tend to become less severe. There's a tendency. However, we were not sure here because of the 30+ mutations. And so for now, if we look at the clinical picture at primary healthcare level, it's mostly mild cases. We're not disputing the fact that there would be patients with severe infections, but they would be very, very few at this level that we are operating on. Then the other very important thing would be if the monoclonal antibodies that you will normally prescribe to people while they are in ICU or hospitalized, whether that would work. We still don't know that as well. But we do know around public measurements, still the same measurements, hand washing, masks, social distancing, stay away from crowds, and get vaccinated as much as possible if you can. Get your people vaccinated. So for now, in any wave, you will normally start with your younger patients. Our latest stats that I have just received show that we have in the past 24 hours 11,535 cases, of which the majority was between the age of between 30 and 50 years of age, 50-55 about of age group. So this is what we are seeing. Then with children under the age of 10, we see around about 115, and then age 80, 30, 73. These cases that they are sending to us change, and I think only after 7 o'clock tonight we will have the final cases for today on the breakdown. But the total cases is 11,500, and this is now since the 18th of November. But globally, in South Africa, the cases didn't immediately started to rise, but this week it started to rise and increase quite significant. We do know that in our public sector hospitals, there is a higher increase of admissions of younger people with comorbidities. And apparently, in the public sector hospital, the majority are not vaccinated. Body aches and pains, my body is sore. I've got sore muscles and I've got a headache. Some of them have got quite a severe headache or complaining of a severe headache and tiredness, but none of them, and this is a difference, none of them will come and sit in front of you, say, I've got loss of smell, loss of taste, got a severe blocked nose, or doctor, I've got a severe temperature. And so if you look at, this is why we say this is milder than your Delta variant at primary healthcare level. At hospital level, that picture might change, but again, it's very early days because there's not a lot of admissions yet in the hospitals. So if you look at what the scientists are saying, they say the R ratio is 6. That might be true. So it is definitely fast spreading. Are it more fast spreading than the Delta? On paper, definitely. In practice, we will see as we go forward within the next week and a half. As I said, our numbers only this week started to increase. We're not saying that everyone that's been vaccinated will always have this mild disease. There must be somewhere along the line, one or less than 1% maybe, that will get severe disease. But so far, luckily, we haven't really seen them. But it might change. But we are worried about the unvaccinated, older people with lots of diseases, as we're still waiting for them to come in.